thought, or are you planning, or just like to hear your thoughts about the possibility of identifying key sites or key information sources, particularly on the web, that would be beneficial to make sure that you pass on to parents? Have you done anything like that?
Yeah,
Have any plans in the pipeline for that type of?
We don't have our own website, but there are very good websites. The British Heart Foundation, for instance, have very good information both in written form and on their website. They have a specific little booklet as well for each of the heart conditions that we treat. Some of the larger children's hospitals, particularly in the States, and I'm thinking, for example, of Cincinnati Children's Hospital, have a very good website as well that gives information appropriate to the conditions. I suppose one of the things that's a bit less controllable are forums where people interact in, and certainly hearing other parents' experience can be a beneficial experience, but there are certain caveats around that, certain risks in forums because they are open to everyone, and some of the views that maybe are expressed maybe of concern to parents who are dealing with a sick child at home.
So do you think it would be beneficial to parents in Northern Ireland and the island of Ireland to have information which has been developed specifically for them by, say, by yourselves and perhaps your counterparts down in the south of Ireland?
I do. I think that we are in the process of developing an all-island network for the care of children with congenital heart disease. That's progressing in terms of the number of children treated through it, and certainly during this current year, a significant number of our children will have surgical treatment through that network. It's also professionally very strong links across the two care teams, and that's something that's taken a lot of work to try and establish across two different political jurisdictions with different health systems. But what we have talked about is trying to develop I feel like a roadmap for all of that, so that we have all of the professionals within the network having something that they can refer to in terms of the processes. And also, I suppose what is important is that the geographical barriers in terms of treatment are not what's important. It's really getting the care for a child, no matter where they live on the island, to get that care delivered as safely and as promptly as possible. And part of that, involved in all of that, to go back to your question, is having appropriate information for those parents as to what their point of access to treatment is. Simple information about where they're going, how to get there. Even as you heard the lady this morning talking about her little baby will be going to Birmingham Children's Hospital during this coming week for a procedure, but he has to travel by air ambulance. He can't go on a commercial flight because he needs closer supervision and to travel with a health professional on that plane. So the mom's concern even is where does she go? So we have a nurse coordinator who will smooth that journey for her as best possible. One of the things we learned over the years in terms of patients going to England for treatment is that one of the most stressful things is that actually going through Heathrow Airport or Gatwick Airport with a child and trying to get to central London, people who maybe not ever even done that journey before. So the things that stress parents in the situation are often the non-medical things. It's the practical support, and we try our best to make that as smooth a journey as for them as possible. But it's not an easy thing for them. The reality of treating congenital heart disease in terms of surgery is that the best outcomes are achieved in centres who are doing large volumes of cases, and And so in the UK and indeed Europe now, the the focus is on building units that have 4 pediatric cardiac surgeons who can work together and do large numbers of cases. And that's why we in Northern Ireland have had to build these relationships with the hospitals in England, with Birmingham Children's Hospital, which is a very specialised surgical unit, and our patients with hypoplastic left heart go there. We've had a strong relationship with the Evelina Hospital in London, and then over the past 2 to 3 years we're now building capacity through the centre in Dublin. It is on a purely practical basis much easier to maintain the working relationship with somewhere that's a couple of hours down the road rather than to have, you know, the air travel. And the air travel itself, you know, is logistically and sometimes medically a concern for babies with congenital heart disease. So there are many pieces in the jigsaw. I think I said earlier that someone said to look after a child with a congenital heart problem takes a village. You know, takes multiple people, and within that team, you know, I often think that it's the people who it's again it comes down to the weakest link in that team. One of the things that I always think is hugely important is that we're all here during the day. There are lots of supports when our patients are looked after during the day, but at night the nurses are on their own in the ward. They do have some medical staff in the hospital, but one of the most important groups of staff are the nurses who look after those patients at night, and they have to be alert to changes, and we're very lucky in that we've had a team who do that. So we in looking after these children, as with other vulnerable groups of children with many other illnesses, you have to have a team ethos within that. I hope that we maintain that, and that the people who perform the different tasks within that should all be valued, you know, not just the medics. So
Thank you very much.